Hi, I'm Derek Fenwick, physical therapist and director of professional development here at Infinity Rehab, and I'm joined by Mike Billings, physical therapist and president of Infinity Rehab. And I appreciate your time today, Mike, to talk a little bit about healthcare reform and the future of healthcare. Sure. What is that? What is that about? I hear this term about triple aim, and I know there's just a lot of transition. Could you maybe comment on that?
You bet. The triple aim is a term that was developed by Dr. Donald Berwick when he was the CEO of the Institute for Healthcare Improvement. He since went on to become the administrator of the Centers for Medicaid and Medicaid Services, CMS. But he developed a model that was designed to transform the healthcare system in the U.S. to shift its focus to one where you improve the patient's experience of the healthcare system, you improve the population health overall, and you do all of that at less cost to the system. Right. As you know, we're seeing costs escalate, and
that's a very attractive proposition.
It is.
Those three.
Yeah, because Dr. Berwick had identified, according to him, 20 to 30% of health spending in the United States is really wasted spending due to inefficiencies and lack of coordination of care, overtreatment, and just really over complexity of a complex administrative system that's just driving up costs. So that's kind of where the triple aim came from.
I kind of heard you just say the complexity. That sounds expensive.
Yeah.
The maybe poor coordination among providers.
Yeah.
And what else is behind the rising costs?
Yeah, those are definitely driving it. Interestingly, the most recent reports have actually shown a slight decline in the rise of healthcare costs, whether that's from economic conditions or interventions from Affordable Care Act. There's some debate there, but the reality is that it is actually slowing. Now, are we where we need to be? No. When you look at our costs, our healthcare costs as a nation compared to other developed nations, we have the highest costs, and unfortunately, we fall way behind in terms of outcomes of key metrics and more child mortality and so forth. So we still have a long ways to go. We have a chronic disease epidemic in this country, and it's really the result of a system that is very reactionary. So what we need to do, and kind of what the triple aim is all about, is moving upstream, so to speak, and saying, hey, let's look at prevention and see if we can get in front of these diseases to help control those costs. In addition, as you mentioned, looking at better coordination of care and really a different model of how healthcare providers are reimbursed. And we're starting to see that, moving from a model that really rewards inefficiency with really no consequences for poor outcomes to one that rewards efficiency and quality outcomes.
Yeah, that balance. Trying to
definitely
find
a balance
between delivering quantity and quality.
Yeah.
Could you talk a little bit more about that failure to coordinate care? Because that sounds, like I said before, that sounds really expensive.
Yeah.
How is, especially in our setting of older adult health care, what does that look like? How do we get past that?
Yeah, great question. When you look at, when you do look at our setting, we operate in that post-acute spectrum of, whether it's inpatient rehab, skilled nursing facility, long-term acute care hospital, home health, outpatient. There are a lot of providers in that post-acute spectrum, and we've really never had any type of incentive to kind of reach out to one another and collaborate and decide, well, how do you, if you and I are in different settings, how are we working together to maximize this patient's outcome and well-being? And we're really kind of got the blinders on, and we're worried, we're doing the best we can with the patient right in front of us. And now it's forcing us to take a step back and say, well, how can you and I partner a little bit better to really come up with the best outcome? So we're, the Affordable Care Act had actually built in, some mechanisms to foster those kind of collaborations, some different innovation models, different payment models, and so it's really driving some new thinking, I guess, in that area. So, great example are hospital readmissions. You've probably seen that in the media and all over. Yeah, like 25% of Medicare beneficiaries are readmitted within 90 days. So
there's a lot of transition.
And so as an industry, we're starting to make some headway there in improving that number, but it's a huge driver of cost. So again, taking practitioners in different settings to work together for to improve that one metric is a great start.
Yeah, and I'm sitting here as a physical therapist. I know you're a physical therapist. I think some of our best days in life are spent with patients. So I think this is a really exciting time. What is the role of the healthcare professional in this transition and the future of healthcare?
Yeah, great question. How does that impact me, right? As a therapist, physical therapy, occupational therapy, speech, language pathology. What's exciting, and it all depends on how you like change. Change can be scary.
Sure.
But I think for therapists, we're moving in a direction where the value we bring as clinicians will be better recognized, I think. Moving away from a commodity-based, volume-based type model to one where our skills and expertise in how we evaluate and assess and treat patients will be rewarded and contribute significantly to that triple aim. So, for example, PTs are extremely skilled in prevention. We're well positioned to be able to provide those prevention type services to patients and to communities, and partner with different agencies, lend our expertise to that particular initiative. So I think we're well positioned for that. I think we're well positioned for reimbursement models that reward quality. Again, I think we're the best qualified people to be getting the outcomes for the types of conditions that that we're seeing in the older adult population in that post-acute spectrum. Yeah. So,
and when you say we, I mean that you're talking that whole allied health profession type world. Obviously, in Infinity, it's physical therapists, occupational therapists, speech language pathologists, and the assistants for those disciplines. That's kind of the world you're talking about.
Yeah, and really even expanding that now. Again, kind of like I was saying earlier about taking the blinders off, where I just worry about my PT plan of care, and an occupational therapist worries about OT. It's really taking those blinders off and saying, all right, how do our goals blend? Ultimately we want to get this patient better, and we want to keep them better. And so it's I talked about kind of collaboration and partnering. Same thing, is that now what do we worrying about that patient after they leave us and they go back to the community, making sure that they're connected to another professional or provider so that new level of independence is maintained.
Yeah, because the last handoff of care.
Exactly. So that handoff transition, that's where again our system has failed, and we as therapists have to be mindful now of that transition and making sure that we are handing off, communicating to that next provider. So for the ultimate outcome for that patient.
The question I have is how do we translate the delivery of care into the reimbursement piece of care? I think it's one of the whole reasons behind the conversation we're having right now is that inability to be able to maybe quantify quality, quantify outcomes, how the treatments are going. What's your opinion about a reimbursement system that focuses more on the outcomes, more on the results?
I'm in favor of it. The bottom line is, and great question. Having said that, you as a provider will need data. You got to know what how many treatments, what the cost of your care is. What's the best way to get there, the most efficient way to deliver your care now. Really using evidence-based practices so that you weed out maybe some of the treatments and that aren't as effective.
Right.
What can you do without? What do you need to increase more of? So you get the best outcome in the shortest amount of time, and that you collect that information and then be able to share that with whatever that, whether it's an accountable care organization, a physician group, bundled payment model, whatever that is, you're going to need to know what your ideal delivery model is, as well as what that cost is.
Yeah, and that is, it's definitely, to be a provider right now is an exciting time. I mean, there's a lot of transition, a lot of unknowns, but it seems like there's a lot of shift toward that kind of future of healthcare that makes sense to providers, I think, that says we want to get paid for doing good work.
Yeah, that's exactly it. And as you look around the country, therapists are today building some really innovative practice models in really all settings. It's pretty exciting time to be a therapist right now.
Good. Well, Micah, thank you for your time. It was great to talk with you about the future of healthcare, and thanks for watching.